Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
Now, our viewers will be more curious to know what is happening after the surgery. So, can you just explain one experience or patient? How do they do post-surgery?
Direct anterior robotic hip replacements has been done for several patients, over 100 in the last year by me in this hospital. And there is nothing more gratifying to a surgeon than your patient walking nicely and he's pain-free and he's back to his action or activities or sports, what he would love to do. There are several such examples and each one is so interesting, and also they have the human touch of improvement in their pain and mobility. One of such example is this software engineer who works abroad, and he developed this COVID, and he had to be admitted in a hospital which required a steroid administration that left him with avascular necrosis, or something we call as a bone cell death. As you may be aware that when the bone gets damaged inside the hip joint, they have a persistent, permanent pain in that hip joint, and which will come in their activities of daily life. This gentleman who was suffering from pain from months and months, and he spent about 2 years visiting several doctors in his country. He was abroad. Then he came back and he consulted several doctors, at least in 2 of the metro hospitals in India. And then he also underwent 2 smaller surgeries in his both hips. Of course, both of them didn't cure his problem, and the results were complete, utter failure in terms of the pain relief and mobility. Then he was looking, being a software engineer and an educated guy, looking for something better to restore his activity back to his sports career, as well as, getting back on his feet very quickly. And then he visited us, and he was so curious. He was so stressed out and the emotionally burnt out that in a young age he's supposed to have a hip replacement surgery, and he wasn't sure what is exactly his life after the surgery. He underwent 1 surgery on the left hip using a direct anterior and a robotic hip surgery in the June of 2024. We made him walk on the same day. Within a couple of days he was up and about and very quickly got discharged. To our own astonishment, within 3 months, he returned back saying that, "Doctor, my first hip is amazing and I would like to get the other one done tomorrow." So he got the other hip as well done, and he recovered so amazingly well. Today, to all our surprise, this gentleman walks as if nothing has happened to him. His wife is a pathologist doctor. You can imagine that how much happy the whole family would have felt, the gentleman himself would have felt after suffering from 2 or 3 years of pain, and with the despair that will I ever get better or not. This gentleman back on his feet as if nothing has happened to him, and he's back in all his activity. And that opens our eye that even with so much of problem, so much of disability, so much of pain, these patients can get back to normal activity, provided that they get correct time in a correct technological advancement if it has been used, and they can be normal.